Dr. Sophia Blackwood had the gentlest hands in pediatric surgery. The nurses at St. Mary's Children's Hospital had seen how she touched a child's aching stomach, how she carefully reset a broken bone, how she saved the life of a 6-year-old heart patient on the operating table. But what the 8 terrorists who invaded St. Mary's Children's Hospital didn't know was that those same hands had once eliminated 23 enemy combatants in a single deployment. And today, the lives of 47 sick children would depend on her choosing violence over healing. On Tuesday morning, at exactly 9:15 a.m., Dr. Sophia Blackwood sat in her office on the 3rd floor of St. Mary's Children's Hospital, reviewing the surgical reports of 8-year-old Emma Collins. Emma's appendectomy had gone perfectly thanks to the gentle, precise touch of Sophia's hands. Everyone at the hospital used the same words when talking about Sophia: gentle, compassionate, perfect. No one would ever use the word deadly to describe her. But this morning, everything was about to change. Dr. Blackwood, Nurse Jennifer Martinez knocked on the door. "Operating room 3 is ready. Are you prepared for little Tommy's heart surgery?" Sophia smiled. Tommy Harrison, 7 years old, a sweet child with a congenital heart condition. They had been planning this surgery for 3 weeks. "Of course, Jennifer. I'll be right there." As Sophia stood up, she looked at the small tattoos on her wrists. On her left wrist, a small heart representing her identity as a pediatric doctor. On her right wrist, something only Jennifer knew about: a SEAL trident, the miniature version of the Navy SEAL badge. 2 identities, 2 lives, 1 woman. Walking down the corridor, Sophia's mind automatically began scanning the hospital's layout. It was a habit from 15 years of military training: exit routes, security cameras, personnel count, potential threat points. Old habits never died. 3rd floor, pediatric surgery wing, 47 small patients, 12 nurses, 6 doctors, 4 security guards. A normal Tuesday morning. There was no sign that anything would go wrong. But Sophia's past had trained her to think differently. Every normal situation was a potential battlefield. When she entered Tommy's room, the little boy looked at her with anxious eyes. "Dr. Ant, will the surgery hurt?" Sophia knelt down beside Tommy, placing those gentle hands on the child's shoulder. "No, sweetie, you won't feel anything. When you wake up, everything will be finished, and your heart will work perfectly." Tommy's mother, Sarah Harrison, sat in the corner trying to hold back tears. "Dr. Blackwood, will everything really be okay?" "Sarah," Sophia took the mother's hand, "I will protect Tommy. I promise." As she said these words, an old memory flashed in Sophia's mind. Afghanistan, 2018. 12 children wounded after a bombing attack. That day, she had made the same promise to mothers, and she had kept that promise. She had saved all 12 children. But to do so, she had to kill 6 Taliban fighters. Each one's last breath had been pleading for mercy. As Tommy was being taken to the operating room, Sophia scanned the corridor one last time. Everything was normal. Security guard Marcus Johnson stood by the elevator. Nurses continued their routines. Visitors sat calmly in the waiting room. 9:45 a.m. Entering the operating room, Sophia mentally rehearsed the surgical procedure while washing her hands. Tommy had a small hole in his heart valve. This hole would be closed and the child would return to normal. A standard procedure, expected to take 2 hours. "Anesthesia ready," Dr. Marcus Chen, the anesthesiologist, said. "Surgical equipment checked," Nurse Linda Rodriguez added. "All right, team. Let's give Tommy a perfect heart." Sophia dried her hands, put on surgical gloves. As Tommy's breathing was regulated, Sophia's mind shifted into that familiar concentration mode. This was the same mental state she had learned in Navy SEAL training: perfect focus, environmental awareness, sharp reflexes. However, exactly 23 minutes after the surgery began, they would realize that nothing in the hospital was normal. 10:08 a.m. The hospital's main entrance door was blown up. The explosion shook the entire building. Windows trembled, and emergency alarms began blaring. But in the 3rd floor operating room, Sophia's hands were inside Tommy's chest, carefully focused on repairing the heart valve. What was that? Linda Rodriguez asked in alarm. I don't know, but we continue the surgery. Sophia's voice was calm and determined. We can't leave Tommy halfway. But a corner of Sophia's mind had already shifted into tactical mode. The explosion sound and emergency alarms told her something. This wasn't an accident. This was an attack. On the ground floor, a heavily armed 8-person team had positioned themselves in the hospital's main entrance hall. The leader spoke over the intercom that broadcast his voice throughout the hospital. Everyone in this hospital, pay attention. This is not a robbery. This is an operation. Everyone stay calm, no one move. No one try to be a hero. Doctors in the pediatric ward on the 3rd floor, you will come downstairs. Especially Dr. Sophia Blackwood. Everyone in the operating room froze. They're looking for you, Dr. Blackwood. Marcus Chen's voice was trembling. Dozens of questions arose in Sophia's mind. Who knew her real name? Who had discovered her past? And most importantly, what did this mean for these 47 sick children? Continue the surgery. Sophia's voice didn't change at all. Tommy's life is in danger. The voice came over the intercom again. Dr. Blackwood, if you don't come downstairs, we'll come upstairs. And then a lot of blood will be spilled in this children's hospital. Linda Rodriguez began to cry. Dr. Blackwood, what should we do? Sophia looked at Tommy's heart. The surgery was 70% complete. Half an hour more was needed. But the lives of 47 children were in danger. Marcus, you finished the surgery. Sophia turned to the anesthesiologist. You can do it. But I'm not a surgeon. You don't need a teacher, just be careful. I'll go downstairs, check the situation, and come back. When Sophia left the operating room, she assessed the situation in the corridor. 12 nurses, 6 doctors, 47 children. Everyone was in terror. Some children were crying. Nurses were trying to calm them down. Jennifer Martinez ran to her. Dr. Blackwood, what will happen now? Sophia's mind began rapidly forming tactical plans. Pediatric ward, 3rd floor, only exit stairs and elevator. 8 armed men downstairs. No escape possibility from upper floors. Classic containment scenario. Jennifer, keep the children in their rooms. Lock the doors. Let me check downstairs. Dr. Blackwood, no, it's too dangerous. Sophia held Jennifer's shoulders, looked directly at her. This look was one that Nurse Jennifer had never seen before. Cold, calculating, deadly. Jennifer, trust me, I can handle this situation. Getting on the elevator, Sophia took a deep breath. The identity she had been trying to hide for 7 years would have to be revealed today. Navy SEAL Petty Officer Sophia Phoenix Blackwood was back on duty. When the elevator descended to the 1st floor, the doors opened and Sophia found herself facing 8 heavily armed men. All wore professional tactical equipment, faces covered, carrying automatic weapons. The leader approached Sophia. Dr. Sophia Blackwood, finally we meet. I don't know who you are, but your hospital. We know who you are, Sophia. Or would you prefer we call you Phoenix? Sophia's blood froze. Phoenix was her Navy SEAL call sign. Only very few people would know this. 15 years ago, there was an operation you carried out in the Middle East. Do you remember? A village, 40 civilians, and you went there to do cleanup. That operation is classified. Sophia's voice hardened. One of the 12 people who died in that operation was our leader's brother. Today it's time for revenge. The men behind the leader pointed their weapons at Sophia. The children are innocent, Sophia said in a calm voice. You killed innocents too, Phoenix. This is justice. Sophia scanned her surroundings. 8 men, strategic positions, automatic weapons. In a standard confrontation she had no chance. But this wasn't a standard situation. Give me 5 minutes, Sophia said. For what? To save the life of the child in surgery upstairs. Then you can do whatever you want with me. The leader thought. 3 minutes. But 2 of my men are coming with you. When Sophia returned to the elevator, she had 2 armed men with her. But what they didn't know was that Sophia already had a plan. When they reached the 3rd floor, they entered the operating room corridor. When Sophia opened the operating room door, she saw Marcus Chen inside trying to complete Tommy's surgery. How's it going, Marcus? Almost finished. I need 10 minutes. Sophia turned to the armed men behind her. You see, the child will die. You have 3 minutes. Okay. I also need to prepare. Sophia went to the surgical equipment cabinet. As the men watched her, Sophia's hands found familiar objects. Surgical scissors 15 centimeters stainless steel, scalpel set perfect for precision cutting, surgical forceps, excellent for gripping, and then what she had hidden in the back of the cabinet. The small package she had placed there 7 years ago, which she never hoped to use but always kept ready. Inside, tactical knife, small smoke bomb, and emergency communication device. Sophia's movement was so fast that the men couldn't understand what happened. The first man was standing to Sophia's left. When the surgical scissors entered below his left ear and reached his brainstem, he didn't have time to understand what was happening. As the second man began to raise his weapon, Sophia's tactical knife cut the carotid artery in his neck. As blood spurted, the man collapsed to the floor. Total time 4.7 seconds. Sophia took the men's weapons, 2 MP5 automatic rifles, fully loaded magazines. She was no longer Dr. Blackwood, she was now Phoenix. In the operating room, Marcus Chen looked at her in horror. Dr. Blackwood, you, how? Marcus, finished the surgery. I'll handle the others. Who are the others? There are 6 more downstairs. As Sophia left the operating room, she reviewed her tactical plan in her mind. 6 enemies, downstairs. Need to keep 47 children safe upstairs. Need to control exit routes, and no one should die. Except the enemies. When she reached the elevator area, she heard voices from downstairs. The leader was shouting, "What's happening upstairs? Where are those 2 men?" Instead of taking the elevator, Sophia went to the stairs. From the stair landing, she observed the situation on the ground floor. 6 men, strategic positions, leader by the door, 2 men holding hospital personnel, 4 nurses, 2 doctors, 3 security guards, the other 3 men guarding exit routes. Sophia's mental calculation: 6 targets, 60 bullets, average distance 25 meters, easy shooting distance, but can't risk civilians. Sophia quietly went down to the 2nd floor, then used the side stairs to get to the 1st floor. Hospital's back entrance, kitchen area. She knew this section very well. She had been working here for 7 years. Moving from the kitchen to the main corridor, Sophia adjusted her position. First target, the man guarding the back exit. 30-meter distance, side shooting angle. The MP5 didn't have a silencer, but Sophia's finger waited on the trigger for a second. Target calculated. First shot, the man collapsed to the floor. The other 5 men immediately reacted, turning their weapons toward where Sophia's shot came from. But Sophia was already moving. She approached the second man from the left corridor. This time she used the tactical knife, silent, effective. As the man fell to the floor, he couldn't even fire his weapon. The remaining 4 men were now in panic. Where is she? Find her. Sophia knew the hospital corridors like the rooms of her own house. Every corner, every hiding place, every tactical advantage. She drew the 3rd man into the radiology section. When the man turned the corner, Sophia was there, but the man couldn't see her, because Sophia was hanging from the ceiling, just like in the infiltration operations she had conducted in enemy camps in Afghanistan 15 years ago. When the man fell to the ground, the remaining 3 men were now in fear. Who is this woman? The leader was shouting. Phoenix. Sophia raised her voice to be heard throughout the hospital. And I will kill anyone who tries to harm children. The leader and the remaining 2 men had now moved to defensive positions. They were using the hostages, hospital personnel, as shields. In this situation, Sophia needed to use a different tactic. Direct assault could result in civilian casualties. She hacked the hospital's intercom system. Her knowledge of medical technology came in handy. Her voice was broadcast throughout the hospital. Children, nurses, doctors. This is Dr. Blackwood. Keep the children in their rooms with you. Lock the doors. Everything will be over in 10 minutes. Then she spoke to the leader. You and your men. As long as you don't touch the children, I'll just kill you. But if you harm a single child, what will you do? The leader mocked. Sophia's answer was action. She cut the hospital's electrical system. The entire first floor was plunged into darkness. There were 15 seconds until emergency lights came on. This time was enough for Sophia. Without night vision goggles, the leader and his men were blind. But Sophia had been working in this building for 7 years. She could know where each step would lead, even with her eyes closed. When the emergency lights came on after 15 seconds, she saw that the leader and 2 men remained. The hostages were safe. Sophia had left them in a distant, secure position. She was left face to face with the last 3 people. Sophia Blackwood, the leader, removed his mask. An old man very familiar. "We meet again after 15 years. Sophia recognized him, Colonel Hassan Mahmoud, from Iraq operations, brother of one of the leaders killed in that operation. "Hassan, I thought you were dead. I lived for revenge for 15 years, Phoenix, and today is that day. You shouldn't have touched the children, Hassan. You shouldn't have touched the children in that village either." As 2 old enemies looked at each other, Sophia made her final calculation in her mind. 3 enemies, 2 armed, 1 Hassan, carrying only a pistol, distance 8 meters. Sophia had MP5 23 bullets left, but Hassan had 1 more ace up his sleeve. "Sophia, even if you kill us, it's too late. In your hospital on the 3rd floor, there's a bomb. It will explode in 5 minutes. 47 children will die." Sophia's heart stopped. "Where? Only I know that. And if I die, the children die too." In this situation, Sophia had only one option: wound Hassan and make him talk. She aimed the MP5 at Hassan's knee and fired. Hassan collapsed to the floor in pain. "Where's the bomb? I won't tell you before I die." Sophia also neutralized the other 2 men, then approached Hassan. "Hassan, I'm a doctor. I can make you suffer a lot without killing you, or I can give you painkillers, defuse the bomb, and then turn you over to the police." Hassan looked at Sophia in pain. This woman was the same cold-blooded warrior he had seen 15 years ago. 3rd floor, operating room, ceiling, 3 minutes left. Sophia gave Hassan a morphine injection, relieved his pain, then secured him with plastic zip ties. Going up to the 3rd floor in the elevator, Sophia recalled bomb disposal procedures in her mind. It was part of Navy SEAL training. When she entered the operating room, she saw that Tommy's surgery was complete. Marcus Chen was relieved to see her. "Dr. Blackwood, Tommy's surgery was successful. Marcus, evacuate the room immediately. There's a bomb in the ceiling." "What?" Sophia began checking the ceiling, hospital ceiling, electrical systems, and she found it. A small plastic bomb, digital timer, 2 minutes 15 seconds left. Sophia remembered her bomb disposal training: red wire, blue wire, green wire, which wire needed to be cut. Timer, 1 minute 45 seconds. Sophia carefully examined the bomb structure. Standard C4 explosive simple timer system. The green wire needed to be cut, but to be sure, she called Hassan. "Hassan, if you're lying after the explosion, I'll tear you apart piece by piece." "Green wire," Hassan groaned. "Cut the green wire." Timer, 47 seconds. Sophia cut the green wire with surgical scissors. The timer stopped. The bomb was defused. 47 children were safe. Sophia collapsed to the floor, still holding the surgical scissors. Bomb components scattered around. Jennifer Martinez ran into the operating room. "Dr. Blackwood, police are coming. Is everything over?" Sophia looked at Jennifer. The nurse she had worked with for 7 years was now looking at her with completely different eyes. "Jennifer, whoever you are, Dr. Blackwood, you saved us. You saved 47 children." Police sirens were approaching. FBI, SWAT, bomb disposal team. Sophia's secret identity was no longer secret, but Tommy Harrison's heart was working perfectly. Emma Collins's appendectomy scars were healing, and 47 children returned home safely that night. Police Chief Rebecca Martinez, Jennifer's sister, spoke with Sophia in the hospital lobby. "Dr. Blackwood, I'm officially asking you, who are you?" Sophia took a deep breath. "I am Dr. Sophia Blackwood, pediatric surgeon.
I'm also former Navy SEAL Petty Officer Sophia Phoenix Blackwood, 3 tours in Afghanistan, 2 tours in Iraq. I left military service 15 years ago. Why? Because I preferred saving lives to taking lives. Until today, I hid this identity. But when the lives of 47 children were in danger, I couldn't remain hidden. Police Chief Martinez thought, what happened tonight? How will we write it in the official report? Sophia smiled. It was the first genuine smile of the day. Right, Dr. Sophia Blackwood, pediatric surgery, protected hospital personnel and patients against terrible details classified. The next morning at St. Mary's Children's Hospital, everything had returned to normal. Sophia sat in her office, reading reports of her pediatric patients. Her hands were still those gentle, compassionate hands, but now everyone knew how deadly those gentle hands could be. Jennifer Martinez entered the office. Dr. Blackwood, Tommy Harrison wants to see you. When Sophia went to Tommy's room, the little boy smiled at her. Dr. Aunt, I heard you saved my mom yesterday. I just did my job, Tommy. Mom thanks you. I thank you too. Tommy touched the tattoos on Sophia's wrists with his small hand, the heart tattoo and the seal trident. What do these mean, Dr. Aunt? Sophia looked into Tommy's eyes. One is for saving hearts, the other is for protecting people. Tommy, can you do both? Sophia smiled. Yes, Tommy, I can do both. That night, as Sophia went home, she looked at herself in the mirror. She no longer had anything to hide. Dr. Sophia Blackwood and Phoenix were now the same person. Gentle hands, deadly skills. Carrying both was difficult, but it was worth it for the smiles of 47 children. And the next day, a new surgery was planned at St. Mary's Children's Hospital. A 6-year-old girl with a heart condition. Sophia was ready, with both of her identities.